Good afternoon, everyone. Thank you very much for joining me today. So I am Lottie Jones. I'm the ESS Nutrition and Wellbeing Officer. And for today's wellness webinar, we will be talking about diabetes and sugar. So just a bit about what I will be running through today. So we'll be talking about what is diabetes, talking about type 1, type 2, and also gestational, the differences between type 1 and type 2 diabetes, the different symptoms and treatment that people use to manage their diabetes. We'll then be looking at how your diet can play a role, focusing on the Eat Well guide and looking at fibre as well. We'll then be talking a bit about different lifestyle changes people can make, and then also the support that is available. So, what is diabetes? So there are about 4.4 million people in the UK that live with diabetes. So that is the combined total of type 1 and type 2. But additionally, it's thought that there are about another 1.2 million people living with type 2 diabetes who are yet to be diagnosed. So those are the sort of numbers that we're looking at within the UK. So then what is diabetes? So the proper name is diabetes mellitus, and it is a condition where you have elevated levels of glucose in your blood. So there's two main types. So you have type 1 diabetes, which is an autoimmune disease, and it has a sudden onset and is not caused by your diet. Then type 2 diabetes is heavily influenced by the diet, and the onset is more kind of gradual and also less severe. You then have gestational diabetes. So this is diabetes which is diagnosed for the first time during pregnancy. And like other types of diabetes, gestational diabetes affects how your cells use sugar, so glucose, and it causes high blood sugar that can affect your pregnancy and also your baby's health. So there are different risk factors associated with diabetes. So approximately 8% of people have type 1, and the remaining 90 or so percent have type 2. And it is thought that there may be a genetic risk factor associated with those that have type 1 diabetes. Then type 2 diabetes has more risk factors associated with it. So genetics is a really strong risk factor for type 2 diabetes. The child of a parent who has type 2 diabetes has a 1 in 3 chance of developing it. So a third. Ethnicity is also a risk factor. So those from South Asian, Chinese, Black African or Afro-Caribbean have a higher chance of developing type 2 diabetes compared to those from other ethnicities. Age is another risk factor. So people over the age of 40 are at a higher risk of developing type 2 diabetes than those under the age of 40. Then lastly, weight is another risk factor. So being overweight or obese can increase your chance of developing type 2 diabetes, especially if this excess weight is carried around the abdomen. So those are the 4 main risk factors. Then just looking at the differences between type 1 and type 2 diabetes. So type 1 diabetes is the body's immune system essentially attacks and destroys the cells which produce insulin. So your pancreas is unable to make insulin, which then means it is impossible to access glucose as energy, which means that it's breaks down fat instead. And then these fatty acids called ketones are released into the body, making the blood acidic. And then this can lead to a life-threatening complication known as diabetic ketoacidosis, also known as DKA. So then looking at type 2 diabetes, so essentially here the body doesn't produce enough insulin, or the body's cells do not react to insulin properly. So here we have the pancreas failing to supply enough insulin, which means that when the body needs more energy, the body sends the signals to the pancreas to release more insulin, and the pancreas is working really hard to pump out this insulin, which results in really high levels of that insulin within the blood. And then in time, our body cells become less sensitive to insulin, which basically can lead to the pancreas becoming damaged. So then we will just go on to symptoms and treatment. So starting with the main symptoms of type 1 diabetes. So these are commonly classified as the 4 T's. So we have toilet, thirsty, tired, and thinner. So just speaking through each of them. With the first one, needing to go to the loo more often, especially at night. This can be due to the body trying to get rid of extra blood glucose, which is why you need to go to the loo more often. Then being thirsty, so being constantly thirsty and not being able to quench the thirst, no matter how much you are drinking. Then being more tired, so this can lead to you having no energy. And the reason you're more tired is because your body is really trying to break down the fat stores, and that can lead to you being really tired. And also that links into the weight loss. So that links into the 4th T, which is getting thinner. So losing a lot of weight without trying to, or just generally looking a lot more thinner than usual. Usually with type 1 diabetes, these symptoms are a lot more obvious and can develop a lot quicker. So they're kind of the main symptoms to look out for. And it's worth noting that if you do personally notice any of these symptoms or anyone close to you, it's worth booking a doctor's appointment to arrange a test to see if you do have type 1 diabetes. Obviously, there can be different reasons for these symptoms, but just to highlight there, if you are concerned, it's always worth getting checked out. So then there are some other symptoms related to diabetes, so cuts and wounds taking a lot longer to heal. So this is because your sugar levels in your blood limit the oxygen, which is what kind of helps to heal those wounds. So that's why they take a lot longer to heal. You then have blurred eyesight. So this is where your blood sugar builds up, making it a bit harder to see. You then have increased hunger, and then also genital itching or thrush. So this can happen due to the high levels of sugar in your urine, which can create an environment for fungal infections. So noting that with type 2 diabetes, the symptoms develop a lot slower and may not be as obvious, which is why there could be up to 1.2 million people living with type 2 diabetes without realizing it, because those symptoms are not as obvious. However, having some of these symptoms, as I've mentioned on the previous slide, doesn't necessarily mean you do have diabetes, but it is always worth booking that appointment with your GP to make sure. So then just a bit about hyper and hypoglycemia. So hyperglycemia is when your blood levels are too high. So symptoms of this include feeling very thirsty, going to the loo a lot, feeling very tired and just lacking that energy, blurred vision, and also losing weight. Whereas hypoglycemia, so this is when your blood levels are too low, so your blood sugar levels are too low. And symptoms here include feeling very hungry, perhaps trembling a lot, sweating, and in more severe cases, individuals may feel confused and struggle to concentrate. So you can see from the picture on the slide, hypoglycemia, you can see the white dots representing the blood sugar levels. So you can see there's only one blood sugar there, whereas in the hyperglycemia, there are a lot more sugars compared to the normal level. And it is worth noting that both can be life-threatening if not treated in time. So then just a bit about treatment and management. So if we start with type 1 diabetes, so there are different treatments. So I will go through them. So insulin is often common for people to have daily insulin injections, or they might have an insulin pump. So this is attached to your body and can release insulin. So you don't need to remember to do the injections. It just does it automatically for you. Next carbohydrate counting, so individuals may keep track of the carbs that they're eating so they can match the insulin to the carbs that they're eating and drinking. Certain apps can do this for you, so they can make the calculations a lot quicker and easier, and make sure you don't miscount during the day. You then have a continuous glucose monitor, also known as CGM, or a flash glucose monitor. So this can check the blood sugar levels regularly with a finger prick test, and they can help to spot whether you are about to kind of head towards a low or high blood sugar levels. So that's those hyperglycemia and hypoglycemia that I was mentioning on the slide before. And it is worth noting that currently there is no cure for type 1 diabetes. Type 2 diabetes is often treated and managed a lot more to do with the diet, so trying to eat well and also move a lot more. This can in turn lead to weight loss, so trying to get away from that overweight or obese state and lose weight. You then have metformin. So this is a medication which individuals may choose to take, and this can reduce the amount of sugar which is released into your body by the liver, and it helps the insulin that you do produce to work better. Then the same as type 1, you can have insulin, so helping to manage your blood sugar levels. Weight loss surgery links to weight loss, so this can help people get to kind of a normal body weight. And then you have those glucose monitors, so helping to monitor the blood sugar levels, but these are not always offered to everyone. So next we'll talk a bit about how you can use your diet to manage diabetes. So first, we have a picture on here of the Eat Well guide, which some of you may or may not be aware of. So it's worth noting that no dietary intervention can prevent or reverse type 1 diabetes, but diet can play a role in helping to manage the condition. So you want to be aiming for a healthy, balanced diet, so in line with the Eat Well guide. So this is aiming for a third of your plate to be fruit and vegetables, so that's the green section. A third of your plate to be carbohydrates, so these are things like your rice, your pasta and your potatoes. Ideally here we want to be aiming for the brown and whole grain varieties. These are higher in fibre, so steering away from your white carbs. Then you have a smaller section for protein, so you want to be having about 2 to 3 portions of this a day, so that's the pink section. So protein is things like meat, eggs, fish, but also beans and pulses. You then have a smaller section for your dairy and alternatives, so that's the blue section. So this is things like your yogurt, your cheese and your milk. Here you do want to make sure that you're not having those high fat varieties, so trying to opt for reduced fat cheeses, your skimmed or semi-skimmed milk, and then there's a very small section for your oils and spreads, so that's the purple section there. So ideally we want to not be having many of these in the diet and opting for unsaturated options where possible. So this is things like your nut and seed oils, your olive oil, and trying to avoid things like butter. It's worth noting that there are a lot of products on the market specifically aimed at those with diabetes. It's worth noting that you don't need to be purchasing these specialist diabetic foods, but if you kind of follow the Eat Well guide, you should be able to have that healthy, balanced diet without having to pay a lot more money for these specific targeted foods. Fibre is also one thing we should be aiming to have a lot of. So as I mentioned, your whole grain varieties of carbohydrates are higher in fibre. You also get fibre from your fruits and your vegetables. So fibre can help slow down your digestion, and it helps, it causes glucose to be released a lot more slowly and steadily. It can help to keep your gut healthy and also help to reduce your blood cholesterol. Ideally, we want to be aiming for 30 grams a day. And as I touched on, your sources include whole grain carbohydrates, fruit and vegetables, and beans and pulses. So what about a low calorie or a low carbohydrate diet in the management of diabetes? So when looking at a low calorie diet, so there has been some evidence that eating a low calorie diet, so around 800 to 1200 calories a day for 12 weeks, can lead to significant weight loss and also a decrease in blood sugar levels. And some individuals found that their type 2 diabetes went into remission. Then going on to the low carbohydrate diet. So research has shown again that this can be an effective way to reverse type 2 diabetes. And a low carbohydrate is around 50 to 120 grams of carbohydrates a day. This can help to manage weight, improve the blood sugar levels, and also decrease the cardiovascular risk. However, it is important to speak to a healthcare professional to ensure that the diet is nutritionally adequate, because often removing those carbs can mean that you are lacking in other areas. However, before changing your diet or opting for something as extreme, because as we know, men and women should be aiming for 2,000 to 2,500 calories a day. So that low carbohydrate diet really is significantly lower than what is recommended. These low calorie or low carbohydrate diets may not be suitable or safe for everyone. So if you are someone who has type 2 diabetes, make sure that you do consult with your doctor or healthcare professional before trying something new. So then just looking at the lifestyle changes. So here I have highlighted exercise and also smoking and alcohol. So in terms of exercise, being active can help your insulin work better in your body. And so this can help to keep your blood sugar levels within target. In terms of exercise, we want to be aiming for about 2.5 hours of exercise a week. Exercise can be classified as anything which gets you out of breath. So this could be obviously your standard things like going for a run, fast walking, doing exercise, going to the gym, but it also includes things like climbing the stairs, doing strenuous housework or gardening. But what we want to be looking for with exercise is anything that gets you out of breath. Exercise can also help those who are pre-diabetic. Exercise is also very good in weight management and can help people to lose weight as well. So that is why exercise is really important as part of a healthy, balanced lifestyle. Then in terms of smoking and alcohol, stopping smoking is really recommended for those with diabetes. As is with having a healthy, balanced diet. Also, alcohol can increase your chance of getting a hypo, so going into that hypoglycemia, because drinking reduces your body's ability to recover when blood sugar levels are dropping. So that is something to be mindful of if you do drink alcohol. Try and stay within your recommended limits and try and avoid it if possible. So we want to be aiming for a lot more exercise to keep healthy, getting out of breath, so going to the gym, anything to raise that heartbeat, and trying to avoid smoking and alcohol. So then when we look at support available, so I have highlighted on this slide 3 different companies and websites. So there's Diabetes UK, so they are a charity that do lots of research around diabetes, lots of fundraising activities. Their website is really informative. So I would suggest that if you are interested in reading a bit more about the topic, to head over there. You also have diabetes.co.uk. So this is a global community, again, which shares information. Then, of course, you have the NHS website, which always comes up with lots of good support available. They might be able to direct you to your kind of closest local clinic, and they also share lots of information about it, so symptoms, treatment, in a bit more detail than I have gone through today. But of course, it's always worth booking an appointment with your GP if things that I've mentioned today do raise concern, or you just want to kind of ask them some questions to see if you're in one of those categories. But that has been quite a whistle-stop core of diabetes, both type 1 and type 2. So what I will do before we go to any questions is I will just highlight the work that we're doing in the team around nutrition and wellbeing. So hopefully you've seen these posters around, but Leanne and myself make up the nutrition and wellbeing team, and we are here for you to ask any of your personal wellbeing queries, or if you would like to book a specific talk at your unit or your site. We also do one-to-one sessions as well. So that is our email address on the bottom of the slide. So if you do have any questions or would like some support, then do just drop us an email. We also have our wellness magazines, so we produce 4 of these throughout the year, and we also do our 12 days of wellness. So these promote kind of what's going on the wider health and wellbeing agenda, so not only in the UK but also globally. Again, you can drop us an email if you would like to sign up to this. And then, of course, you're all here for the wellness webinar, but if you know a colleague or someone within your team who wasn't able to join today, do let them know that they all get uploaded onto our YouTube channel. So if you've missed any throughout the year, I would advise to go and have a look on that. So our YouTube is We Are ESS, and we've covered things like last month was women's health, we've done general nutrition, and wellbeing, and kind of the Eat Well guide, that was a focus. We've spoken about digestive health and heart health as well. So lots of different topics which get covered. So I would advise you have a look at that. What I will do is I will just come back to the screen so that I can see if any questions have been asked, and I will leave our email address up there if you would like to ask any queries. Hopefully you have found today's webinar informative and there's some things that you can take away. If there are any specific topics you would like us to cover in the future, do drop us an email, because we want to make sure that everyone's kind of thoughts are covered, and we cover lots of wide range of topics. So thank you very much everyone for joining. If you have a question but you would perhaps like to email it to us, please do that using the email address, and we can get back to you if you don't want to ask it in this session. Someone has just asked if the slides will be available. So the webinar will go up on YouTube, so you'll be able to access the slides from that. If you drop me an email, I might be able to share some kind of a highlight sheet for you. But I think that is it for the questions. So thank you very much for joining me this afternoon, and hopefully I will see you in next month's wellness webinar. So thank you very much, everyone.